Why have thousands of hospitals across the country stopped offering cashless treatment? The real reason will shock you. Just imagine, it's 2 o'clock at night. A member of your family suddenly falls seriously ill. You rush them to the nearest big private hospital. At the reception, you show your health insurance card, expecting that under the cashless facility, the admission process will begin immediately. But instead, a cold response comes from the desk. Sorry sir, cashless treatment is no longer available under your policy. You'll have to deposit an advance in cash. In that moment, the ground slips from under your feet. The very insurance policy for which you've been paying premiums for years, the one you trusted to save you from out-of-pocket expenses in tough times, suddenly turns useless. This isn't a fictional scenario. It is the harsh reality faced by millions of policyholders in India today. And that's exactly what we'll discuss in detail. But before we begin, if you're new to our channel, don't forget to subscribe so that you always receive our latest updates first. Now, let's dive straight into today's discussion. More than 15,000 hospitals across the country have, in one stroke, terminated their cashless treatment contracts with insurance companies. This decision has been in effect since September 1, and its impact has fallen hardest on ordinary people who buy health insurance so they don't have to bear the heavy burden of hospital expenses from their own pockets. But now, patients will have to pay upfront for treatment and then go through the long and painful process of filing a claim later. The question is, why did this happen? Why are hospitals and insurance companies making ordinary patients the ones caught in the middle? The real reason behind this entire dispute is the growing conflict between hospitals and insurance companies. Hospitals argue that insurance companies are insisting on treatment at rates fixed 10 years ago. In other words, the rates set back in 2014 are still being applied in 2025. But has the cost of healthcare remained unchanged over the past decade? The prices of medicines, diagnostic tests, staff salaries, medical equipment, and infrastructure costs have all been steadily rising. According to hospitals, the actual cost of treatment today is far higher than the packages insurance companies are willing to pay. Dr. Manish Madhukar, a member of the Haryana Private Hospitals Association, stated clearly, insurance companies want patients to be treated at rates fixed 10 years ago. But treatment costs should be updated every 2 years. Instead, insurance companies are slashing prices of medicines and tests, lowering room rents, and taking weeks to approve bills even after discharge. This is increasing the financial burden on hospitals. That's why we were left with no choice but to discontinue the cashless facility. In Rajasthan, the situation is even more serious. Under the 𝐟𝐨𝐥𝐥𝐸 scheme, 701 private hospitals have stopped offering cashless treatment. The reason? Nearly 1,000 crore in pending payments from the government. This has directly impacted more than 3.5 million government employees and their families. Just imagine, a government teacher or a police officer who has served honestly all his life, when his family needs urgent treatment, is told by the hospital, the government hasn't paid us, so we cannot treat you. This is not just an economic crisis, but a humanitarian one. The true picture of India's health insurance sector is revealed through claim rejections. In the financial year 2024, insurance companies rejected claims worth 26,000 crore, a 19% increase from the previous year. This means that while millions of people pay premiums every year when they need help the most, insurance companies find one excuse or another to deny their claims. Data shows that 36.5 crore policies were issued, but claims worth only 7.66 lakh crore were approved, while claims worth 3.53 lakh crore were rejected. These figures alone expose the reality of the insurance sector. For the common policyholder, the big question now is, what to do? People took insurance so that they could get relief during emergencies. But now, they must first spend out of their own pockets and then fight a long battle with the insurance company for reimbursement. Just think, If a middle-class family earning 30 to 40,000 per month suddenly has to arrange 3 to 4 lakh for an operation, where will they get the money from? This struggle is not just about finances. It can be a matter of life and death. Insurance companies also have their own side of the story. They argue that hospitals charge arbitrary rates. Patients are prescribed tests that aren't necessary. Expensive branded medicines are given instead of affordable ones, and charges often exceed the agreed package. In such a situation, if insurance companies give hospitals complete freedom, their business model would collapse. Their stance is that they will only honor expenses that are medically justified. But who ends up suffering the most? The ordinary patient, because he can fight neither the hospital nor the insurance company. The health insurance sector in India has grown rapidly. Today, around 40 crore people are covered under some form of health insurance. But the actual coverage and real benefits are very limited. Nearly 55% of India's total healthcare expenses are still paid out of pocket. This means that despite having insurance, people are forced to take loans, pawn jewelry, sell land, and then get treatment. It is a bitter irony that in the world's fifth largest economy, citizens still have to bear such a heavy financial burden for basic healthcare. Experts believe that India urgently needs sweeping reforms in the health insurance sector. First of all, there must be a balance between hospitals and insurance companies. Hospitals should not have the freedom to generate arbitrary bills, and insurance companies should not be in a position to unfairly reject claims. For this, a strict independent regulatory body will have to closely monitor and enforce accountability. Second, patients' interests must be made the top priority. In today's system, the patient is the weakest link. Both hospitals and insurance companies impose their own conditions, and the patient is forced to suffer in between. If India truly wants to become a healthy nation, health insurance policies must be made transparent and fair. Third, the government too has to play its role. Schemes like Ayushman Bharat provide coverage to millions of poor citizens. But the middle class, which depends on private insurance, has no solid safety net. This is the reason why the suspension of cashless facilities has hit the middle class the hardest this time. Just imagine, if 100 people in a city fall ill at once and 70 of them have insurance, but the hospital tells them there is no cashless facility, the situation would be terrifying. Deposit cash at admission or treatment stops. This reality has left millions of people insecure and helpless. The battle between hospitals and insurance companies is not only about money, it's also about trust. Ordinary citizens had placed their trust in insurance. They had placed their trust in hospitals. But when the time of need arrived, both raised their hands in refusal. This is a crisis of trust, and it threatens to weaken India's entire healthcare system.
Taught you something new, do not forget to like and share this video so that this information can reach others as well. Your likes and shares are a source of inspiration for us. If you have any questions or suggestions, please let us know in the comments. It will be our honor to answer your questions and listen to suggestions. And yes, if you like our content, subscribe to the channel and press the bell icon so that you stay connected with every new story. Thank you. GRT Business YouTube channel sources, news from various news agencies, opinion polls and other public sources. We try to ensure that every report and summary is accurate and verified, but we are not responsible for any dispute or error. Our aim is only to provide you with accurate information.